Spotlighting Hawaii's leaders.
We want to bring in Governor David E.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yunji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser. This episode of Spotlight Hawaii is brought to you by Chaminade University.
Aloha and happy Aloha Friday. I'm Ryan Kalei Suji, joined by Yunji Denise, and this is Spotlight Hawaii. We're a few minutes late, but thank you so much for your patience and for tuning in here this morning as we focus in on our neighbor island hospitals, Yunji.
That's right. We wanted to get an update on how things are going there. We know that the COVID case counts have been dropping, and that's very good news. But our neighbor island facilities obviously have limited capacity. They've experienced a lot of stress as we've seen the numbers rise. And now how are they doing with the decline? We've asked Mike Rembis of Maui Health and Dan Brinkman of Hilo Medical Center to be with us this morning. They're both CEOs of their respective organizations. And I want to start with you. Thank you for being here this morning. How are things going at Hilo Medical?
Well, thank you for having me on, and I'm glad to say that things have gotten quite a bit better. We're only a little over completely full versus way over completely full, which is certainly an improvement for us. Our COVID numbers have dropped. They've slowed their decrease here over the last few days, but they're still headed in the right direction. So that's been a relief for our staff. We still are quite busy, but I think we see some end in sight to this latest COVID surge.
And Mike, how about you? How are things looking over there on Maui with Maui Health?
Similar to what Dan's experienced, we also are seeing a rather significant reduction in positivity rate on Maui, which results in a lower census of positive patients at Maui Memorial Hospital. I would say in the last week, we finally have some respite. For the first time, our staff can take some time off and have a breather. We only have 7 positive COVID patients in today versus over 40 just a few weeks ago. Significant reduction, significant opportunity for our staff to recover. They were working extraordinarily hard, doing an amazing job taking care of our community. And we're seeing for the first time, much like Hilo is seeing, some significant reduction in the surge.
You know, Dan, there's some feedback here. Sorry for the technical issues. Dan, I want to ask you, following on that, when we had talked to you folks a couple weeks ago, there was a concern because a lot of the people who had contracted COVID were staying for a long time. What are you seeing in terms of patient stay and how long those, your system is basically clogged up with these patients who need this longer term care?
You bring up a really good point. We've seen a very get some feedback there, but a very long length of stay with our COVID patients. Some of them, we call them long haulers, which I think has kind of become the industry term for this, but where they're staying 20, 30 days. And some of them recover, but unfortunately, we've seen a number that haven't. And like today, we have 14 COVID in the hospital. A good chunk of them have been here over 10 days already. And we're thankful we haven't seen a lot of new input of new COVID admissions. So the pipeline, the feed has slowed tremendously, but we still have a lot of patients who are still trying to recover from COVID. And as I mentioned before, some of them just really, they're passing away, and that's very unfortunate.
Mike, if we can talk a little more about the support that you are getting from those nurses that we know have come into the state to help with that. Has Maui Health benefited from that? And if you can give us an update on what you're seeing there.
Well, the nurses that were provided through FEMO have been a godsend to our community. Our staff was stretched beyond our understanding of what they could have done. They just did an amazing job. The FEMA nurses have come here. We have about 50 of them serving both Maui Memorial Hospital and our Kula Hospital. They've been able to take over the majority of the care for the COVID patients, giving a significant amount of relief to our staff that were putting in tremendous amount of hours. They have made a real difference. And for the first time, I think I can tell you that our staffing is very good at Maui Memorial, and our staff is having a respite finally. I think they were key to our success in being able to expand our capacity for COVID beyond what we've ever done before. And it was done with safe, good, quality patient care, thanks to the additional staffing and the great work of our nurses here at Maui Memorial.
Just to follow up on, oh, sorry, Mike, just to follow up on that, how much longer do you expect that support to last?
I believe they're going to be probably for another 4 to 5 weeks. I think if the surge continues to drop, and we all hope and pray that it will continue to drop, we'll be fine if they leave. But we are seeing throughout the industry, and Maui's no different, really a shortage of caregivers. So these FEMA nurses were here at the right time to provide care for our patients on Maui.
Dan, to follow up on what you had mentioned earlier about those long haul cases, and we know that that has been something of an issue for some of the hospitals and their overall capacity to be able to house these patients for an extended time and these extended stays. How are you dealing with some of those who are having and suffering through COVID for these longer duration of time?
So it definitely is a challenge for us. We went through a period where we had 22 ICU patients, like double our capacity, but 10 of those were long-haul COVID patients. I mean, I don't want to be defeatist or morbid, but the majority of those, individuals, they've passed away over the past few weeks, and I think we'll have a few, so a smaller percentage that will need some long-term care and support and potentially specialized post-acute care. But what we're seeing, at least in our facility, is it's sad, but a lot of these individuals, they don't survive COVID. It can be a very deadly disease.
So Dan, what I'm hearing you say is that hospital capacity and things have sort of been alleviated, not necessarily because people are getting better, but because these patients have perished. Is that right?
On the ICU side, that unfortunately has been true. For our COVID patients, our long hauls, there hasn't been a lot of recovery there. As far as our overall capacity, though, and our numbers of acute patients that are not in the ICU, many of them, they did get better. They did leave, especially those that were vaccinated and got a breakthrough infection. Some of their lengths of stays were very short. But those, unfortunately, who progressed and had severe COVID and it ended up on our ventilator in the ICU, they've been very challenged. They haven't had we haven't had good numbers.
And Mike, that same question for you regarding those long haulers and how you are dealing with some of those patients that are staying in your hospitals for an extended amount of time. How has that been putting pressure on your overall capacity as a hospital, but also just the staffing?
Well, it had a significant impact on both our census and our staffing in the last month. It's amazing how many patients are no longer infectious. They've been here for a number of weeks, but they still have a number of medical conditions associated with COVID, and they're long haulers. They're going to be here for a few more days or sometimes weeks or a month before they are able to go home. So it's increased our census. At one point, we were pretty full each and every day, almost at capacity. Now we're seeing some of those patients being discharged and going home. So we're seeing some relief, but some of these people are going to have long haul complications for quite some time. It's very sad, but it's inevitable. Many people, especially with comorbidities, other medical problems, once they get COVID, they have significant problems that will continue for a number of months. And we just don't know how long they're going to need care. Most of them are finally being discharged. But after someone's infectious for 10 to 14 days, that doesn't mean that they're out of the woods. They're still going to need, many of them, medical care, and many of them are still here. and hopefully are being discharged as we move forward.
Mike, following up on that, I wanted to ask about treatment options. We've heard a lot about monoclonal antibodies in the last few weeks. Is your hospital able to administer those? And do you have enough of these supplies for what you need there on Maui?
We are administrating them. On Maui, we decided to do a joint project with Kaiser Permanente since their clinic is right next door. So we are jointly administering as much as we can. It's been very effective. It's been a great option for people to reduce their symptoms and stay out of the hospital. The problem is we don't have enough doses. The whole state and the country is experiencing inadequate supply to meet the demand, but we are administering every single dose that we get. Our medical community is aware of the criteria, and physicians are referring patients, and we're trying to provide as much as we can when the patients are presented.
Don, over to you now. When we talk about just the care that's happening, of course, on our neighbor islands, we know the critical role that both of your hospitals play on the neighbor islands. But also important is the role that, some of the trauma centers here on Oahu, like Queens Medical Center, plays in just being able to treat some of the patients that you are unable to provide care for some of those more extreme cases. What has that been like now? We know that at one point, of course, Queens was also at a point where they were struggling to keep up with just the overall people that are coming into the hospital. But if you can speak to the relationship with some of these hospitals on Oahu and how you've been managing who you send to Oahu for, further care.
So definitely there's been times over the last few weeks where it's been a challenge to have transfers occur quickly, and that's through nobody's fault. The Oahu hospitals were very full, as with every hospital in the state. It's certainly gotten quite a bit better. I will say throughout the entire process, though, that we were able, when we had someone who was really critical and there was specialized care like a head trauma or something that couldn't be treated, we were able to get that patient transferred. For COVID patients, unless they move to a process where they get a really high-level treatment called ECMO, we pretty much keep all our COVID patients here. But most of our transfers are for head trauma. It's probably the majority of our transfers in pediatrics. And we were able to get those patients out even through the height of the crisis. Now, it's much easier now because there has been some decompression in all those facilities, but it highlights the need of the whole state to work as one team. I just want to applaud the Hospital Association or the Healthcare Association of Hawaii for the coordinating and communication between hospitals as we got full and how we could basically help each other. So I think as a system within the state, I think the response has been admirable, even though we were really strained.
And Mike, I want to ask you about vaccinations now. We know that some parts of Maui County at times have had some of the lowest vaccination rates in the state. Have you seen an uptick at your organization of people getting those first and second doses?
We have seen an uptick. It's not enough, though, I'll be honest with you. Unfortunately, Maui has the lowest vaccination percentage. We need more people to come and get vaccinated. We are doing most of the Pfizer vaccinations for the entire county. We have a vaccination center set up in our lobby. We were doing over 850 people a day. Now we're doing a couple hundred. We have more people that need to be vaccinated. We are now expanding our hours now that the third shot is available. So with expanded hours, we hope more people will come in not only for the third shot if they're qualified, but we're hoping that more people will come in for their first shot. We have the vaccine, we have the hours and availability, and we're out in the community trying to convince people it's the best thing for them and for our community to get vaccinated. We also are going to all the hotels on the island and doing education for their employees and actually doing vaccines at the hotels for their employees if they want it. So not only are we providing vaccines here at the hospital, but we're going into the community trying to educate and vaccinate.
And Mike, just to follow up on the care that you provide, not only for the island of Maui, but we know, of course, Maui County includes, the residents on Lanai and Molokai as well. If you can speak to just the efforts of Maui Health to reach some of those other rural communities, not only with the vaccination efforts, but overall their care during this COVID crisis?
Well, we've been very committed to the island of Lanai. We have a critical care access hospital there. We have been doing vaccinations from the very beginning. We are constantly going there and providing vaccination clinics. We also have testing capabilities for a lot of the workers and employees that want to be tested on a regular basis. We're very closely working with the Lanai Emergency Operations Center. We are committed to making sure that island is safe, and we'll be there to provide whatever care they need. And I know Queens is doing the same on Molokai.
We've got some, sorry, I got some feedback issues. Dan, I want to ask you the same question. Have you seen a change in the vaccination rates in Hilo?
The short answer is yes. I think, speaking bluntly, Delta scared a lot of people, and our hospitals being full also, I think, encouraged some of the people on the sidelines to get vaccinated. So we saw that in some of our vaccination centers. We're also part of a group that kind of tracks what the whole island, Hawaii Island, is doing, and they also reported some uptick of people getting their first shots, and of course, still some the second. I think Mike mentioned as well, we've seen an increase due to boosters. We started doing them on Monday for our caregivers here, both at the hospital and also in the community. And then we've had, some of our immunocompromised folks were eligible even earlier. So like in just this past, just yesterday, we did 150 boosters in addition to our about 75 first or second shot. So we have seen an increase. We think it's a good thing, and we're kind of excited about the 5 to 11-year-olds are now eligible. I think that will help get our numbers up because herd immunity, I think, is going to have to probably be up there in the 80% or higher for us to not have to repeat what we just went through.
Dan, when we look at this entire COVID crisis and the impacts that it has had, of course, on our healthcare workers, you have to think about just the amount of time that many of the workers that you manage have had to be dealing with this and just the amount of toll that it takes on your employees. What are you hearing from your workers just overall in their own mental and sometimes physical health in being able to deal with the crisis for the length of time that they've had to really help provide that care during this duration of COVID-19?
Yeah, I have to have big kudos out to all our staff. Mike was acknowledging and honestly bragging on the way people stepped up, and that certainly happened here in Hilo. We're the sole provider for our service area, and it is in its own way a small town, and people really rally to care for their community. We've had almost 700 additional shifts picked up by staff. They worked odd shifts and doubles and whatever we needed to get things done. But that's wonderful. It helped us get through it, but there definitely is some fatigue and some burnout. COVID's a bad word around here. We've learned to live with it, but it's definitely been a strain. But I also think it has brought out the best in our community and our organization. I just don't want to have to repeat it.
And Mike, is the same question for you when you look at all that your staff has been through? We've heard some pretty heart-wrenching stories from some healthcare providers on the mainland who say that, they've even had panic buttons in some hospitals now because of the conflict between some patients and the caregivers that are there, tasked with taking care of them. What have you heard from your staff in terms of any patient conflict and also this issue that Dan brought up about potential burnout?
Well, there's no question our staff is extremely tired. They've done an amazing job, but it takes a toll on you. It takes a physical and an emotional toll. I think one of the hardest things for our staff is not only providing care for patients in a very difficult situation, but care when visitors and family can't visit. That has been an emotional drain on them. It's hard not only to take care of the patient, but to try to communicate with the family through phones, through video conferences. The family is so important in supporting the care of the patient. When they're not there, it provides an additional burden on our staff, and that has been extremely difficult. as we start to open up visitation again, it's going to be a real relief for our staff. But our staff has done good. For the first time, we're actually suggesting some of them take a day off, something they've not been able to do for months. So I think they're going to be able to recharge their batteries. But yes, it's taken a toll. Some people have left the organization. Some people may have decided to retire early, but the vast majority of the staff is here. Very happy we have relief with the additional nursing, and very happy the surge is being reduced so dramatically right now. So I think we're going to do fine, but it had a significant toll, both physically and emotionally, on our staff and our physicians too. It's not just our staff that take care of the patients. Physicians are our partners, and they have experienced burnout. They're exhausted as well.
As we wrap up our conversation this morning, Mike, I want to talk to you directly. Sorry, here we're running some technical issues. But Mike, as we wrap things up here, wanted to just get your thoughts looking forward. You kind of highlighted some of those things just moments ago. But when speaking to the governor earlier this week, he said that the hospitals would actually be the indicator of when we begin to see the things reopening here in the state of Hawaii. He's working, of course, closely with all the hospitals, as he said, to really track where we are as a state. Moving forward, are you pretty optimistic? And what are your thoughts as we see these next few weeks coming out of this latest surge? Mike, we'll ask that to you.
Right. We believe that the governor was very, very helpful in asking the hospital industry to help them figure out how do we handle maximum capacity. We were very, very close, I think, all the hospitals, in reaching our point where we couldn't provide safe care. Unfortunately, we never got there. But we've learned so much as a result. We now know how much we can handle safely. And working with the governor and the Healthcare Association of Hawaii, we're setting up guidelines and processes to put into place that if we ever have such a huge surge again, we know exactly when we're going to be at the point where we're going to need additional help and when we're going to be at capacity. And I hope and pray we're never there again. But we've learned lessons. We are better prepared than ever before to deal with another surge if it should ever occur.
You the last word this morning. If you could just give us your take on what you're seeing in the road ahead. When we had Dr. Libby Char on here not too long ago, she was really pleading with the public to just hold on for another month or so, saying that we should really limit our activities because we are still not completely out of it. There is this perception as the numbers go down and hospital capacity kind of eases up a little bit that we're kind of in the safe zone again. What is your message to the community about the medical industry, the medical availability and care right now?
Well, I think it's still the same consistent message, which need to get vaccinated and get those numbers up. We're not at herd immunity now, and I'm hopeful that parents with their children, those who maybe are still on the fence, that they don't just assume, hey, we're out of it, and we don't quite get it over the finish line. So that'd probably be my first thing is let's get vaccinated. Let's get our numbers up and really protect ourselves, because you never know what the next variant may be that comes around. And as far as the community in general is, should we be optimistic about opening up and maybe, I don't want to jinx ourselves, but getting back to normal again? I'm optimistic. I mean, I think if we look at the general numbers in the state, the trend has been certainly up for vaccinations. If we can get even a substantial portion of our kids vaccinated, we're going to get pretty close to those numbers. So again, a lot to be positive about. And I think we'll see our numbers down, and maybe one of these days we might still have to wear a mask, but maybe we can get together and gather as we, without doing the head count, to see how many people we have around.
Well, Dan Brinkman and Mike Rembis from Maui, thank you so much for joining us here this morning and providing an insight into what's happening on our neighbor islands. And thank you and on your staff for all the work that you both are doing for our community. Mahalo.
Yeah, mahalo. You're welcome.
Thank you. Well, we appreciate all of you and thank you for sticking through some of those technical difficulties. We had a little bit of feedback here this morning, but the message came through loud and clear, and that is that these healthcare providers are relieved in some sense because the numbers are going down, but it's not time to let our guard down because, the capacity is only so much. And we really did reach a point, as you heard Mike say there, that we're right up to the edge and they really don't want to go back there. So the ultimate message is please get vaccinated. The other interesting thing was when he talked about monoclonal antibodies, and he said that basically they're using every single dose that they get.
Yeah, I think that really a sentiment that we've heard from other hospitals as well, just the demand for this form of treatment for COVID-19. And also great to hear from Mike saying that they're encouraging some employees to take a day off. I mean, when you think about just the amount of work that they've gone through during this past year and a half, being able to take a day off seems like just a luxury for many of these people, what has become a day-to-day battle. So great to hear that they are getting that opportunity, and also that those numbers are going down on the neighbor islands as well, because we know that those numbers ultimately also impact what we're seeing here on Oahu as well.
Absolutely. And encouraging everyone, if you have not gotten a vaccine, to please get one. Also, those booster shots are now available at both of those medical facilities. So that's good to hear. Also nice to hear about the outreach that they're doing, going down to the hotels and engaging people where they work to hopefully increase those vaccinations as well. So good news all around. Wonderful to have that update from Hilo Medical Center and from Maui Health. We appreciate both of those CEOs this morning. We're going to be turning our attention on Monday to the Lieutenant Governor. He's always a popular guest. He'll be here at 10:30, so please do join us there, 10:30 with Dr. Josh Green right here on Monday.
Thanks so much for joining us and have a great weekend. Aloha.
This episode of Spotlight Hawaii was brought to you by Chaminade University.